Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Well, we're at it again. Here we are with another wonderful interview. That's why I love the radio show. I love the radio show myself, and I know a lot of people do, but I try to find the most interesting and the best people so you can listen and enjoy and learn. And Dr. Jason Alviene has been on before. He's on every week, and he's a chiropractor, but just not a typical chiropractor. He has some other things that are really even better. So let's see what you really do. That if someone asked you what you do compared to other chiropractors, how would you kind of give me an elevator speech about that?
Well, I think the difference between me and traditional chiropractic is that traditional chiropractic, which is what usually brings somebody in the office, is focusing on the discomfort reduction, so pain reduction, sprains, strains, headaches, these type of things, and work on getting that out of the way. In my office, I focus on correcting the structure. So we look for structural shifts within the body, and what we do is try to get them back to a more normal position. And then usually the secondary conditions, if that's a cause, the headaches, the sprains, the strains, the pain and things like that usually resolve from working on the structure. So it's more of a long-term type of chiropractic where you're looking at maybe 2 to 3 months of care to get you back to a normal position before you're released instead of 2 to 3 weeks.
So let's talk about people who complain about headaches. I have friends. I never get a headache, but some people get migraine headaches. So if they went to you, what are you going? I mean, there's all sorts of medication, everything they kind of do, but what would you suggest someone does if they have a migraine besides come to you?
It needs to have an evaluation. The evaluation I would do would be to determine on whether the headache is caused through a structural shift that's going on maybe within the jaw or the upper neck where the nerves come out of. And if that's the case, we could work with it. If it's not coming from there, I would refer out to whether it be a vascular doctor or depending on maybe a neurologist, depending on what might be causing it outside of what I work on.
So you know, it's interesting that I've talked to people who've been to all those things and they still have migraine headaches.
Yeah.
So, I mean, I wonder if it's diet or if it's stress or if it's things that doctors don't really talk about. I know you do.
Yeah, so again, lots of times what's causing these things to come in the first place, it's usually been there for a while by the time you get to that point. So it's putting together a plan, and like I said, it's what seems like a long time, but anywhere from 2 to 3 months is actually a relatively short time to get a change within the body. And once you get that change, you'll know if that was the cause. But the structural detection that we do within the practice to be able to figure out what has shifted in the spine that might be affecting the nerves that go to these tissues, if we can detect that and find it, we can definitely fix it.
There's so many other things. I just talked to a friend of mine in California yesterday, and she's Swiss, she's smart, she's been involved in all sorts of clinical trials for everything, and now she finds herself, and I don't know the name of it, she said it has symptoms like Parkinson's, and they're all working to figure out what it is. So, you know, the body's a strange thing, and I know you know that because, first of all, you started, as you told me, you started out as a massage therapist, and in order to be a massage therapist, and I didn't know this, but I have a friend who's practicing, she's taking anatomy, she's taking all sorts of things.
Oh, yeah.
And I don't think, you know, when you see these signs and it says massage, a lot of times they're cute women who are doing, you know, massage plus maybe other things too, happy endings, I don't know. But a real massage therapist, as you have been, and I have massage therapy every month. It is serious. You do have to know the body, and the body is complex, isn't it?
Oh yes, yeah. I mean, there's so many things about the body that we don't understand yet, but what we do understand, we're able to work with the best we can. So when it comes down to it, is I see everybody wants to be able to work within their life and play within their life using their body to the best of their ability, and that's what I focus on. Is I want people to be able to continue doing what they love doing.
So, for those of you looking for an excellent chiropractor, my guest today is Dr. Jason Alviene, Alviene, and he has now started his own practice. He's been with another group for a few years, but now he's it's called Profusion Chiropractic, and you're actually located in Delray, and I guess I could give the address. It's 1200 Northwest 17th Avenue. Is that true?
Yes.
No, that's
yes.
true? Okay, and you're right there, and where's in Delray, actually?
So we're just north of Atlantic, just off of Congress.
Okay, and someone should make an appointment if they want to see you. I'll give people your number. It's 561 504 6344. Is that right? Okay, and the website is PROFUSIONCHIROPRACTIC.com. What does profusion mean? I think I asked you that before.
Yeah, it means
it's a great word.
It means abundance, and I know when you're living your life, you want to live it to your full potential. So if you can have a body that works to its full potential, you're going to have an abundant life. So profusion is just about looking at the whole and not just parts.
So what do you do when you need a chiropractor? I mean, do you ever need a
Oh,
you
yeah.
just reach your hand back? No, you don't do that. What do you do?
Luckily, that within this field, we meet a lot of other chiropractors at conventions and everything, and we all need to get adjusted. So we work with each other. I have a friend that's down in Sunrise Plantation area that I will see him and we'll adjust each other.
Adjust each other, huh?
Oh, yeah. Yeah. I mean, I have to make sure my body works as good as it can because I'm working on people. And if I'm not doing good, I can't continue helping others.
All right. And so you said something that when someone comes in, let's say they don't have any problems. They just know that they should see a chiropractor at least once a month or something, even every 3 months or whatever, just to keep their body in shape. So you evaluate them first, and let's say, okay, well, nothing seems to be wrong. But what will you do? Just give them a norm. Just tell us what you do as a chiropractor to someone that doesn't have a particular thing wrong.
Well, I'll still bring them through the process of an exam and history to find out where they've been, what's been going on. And if we do notice anything that might be shifted but it's not causing any secondary complaints yet, we'll let them know and make a plan if they want to get that corrected at the time. But usually somebody that's doing really well, they might see me once a month, once every 2 months, just to get checked and make sure everything stays in place.
And so, do you have to take an x-ray of someone who comes in first? I mean, how do you know that everything's okay?
Well, you go by basically your clinical decision. So you may not know everything's okay 100% unless you're doing all the exams and all the lab tests and everything like that. And even with those, somebody could be having something going on that's not detected yet. So it's you got to be mindful, and this is why having regular checkups, whether with your MD or within my office, just to catch things before they do cause any problems.
So there are a lot of people who do running, and inevitably I hear that they've hurt their foot, they've hurt their leg, they've hurt their back. Why is it a good idea? I know you're a runner.
Yes.
Tell me about that.
Well, I was doing a volunteer event about 6 or 7 years ago at Ironman, Florida. And I was working within the massage therapy area, even as a chiropractor, but I got to work with the athletes when they crossed the finish line. The one thing I noticed when the professionals crossed the finish line and they came to the table, when I put my hands on them to help loosen them up and work them out, their muscles felt like butter. It felt like they had not run a race. And one of the professionals told me, I asked him what his secret was. He said that he trains hard, but he recovers harder. So it's the recovery portion of the training plan that needs to be followed even more than the training plan. So we find that these runners that are amateur runners, or they just want to be able to run for health and everything, and they just focus on that and they don't focus on the health of the tissues afterwards, tend to start having more problems more frequently.
And explain that. What is that?
So if you, recovery process, there's all different types. Some people might do foam rolling, massage.
Wait. What'd you say? Foam?
Foam rolling, yes. It's a giant roller that's made out of foam, and it's a self massage per se that people can do at home, and that helps loosen up the muscles. But you need to have that work like massage, chiropractic, physical therapy. Any of these type of fields can help the body recover when they're putting themselves through these strenuous events.
So I have an exercise room at my condo, and when I go down to ride on the bike, I don't really stretch first because I've been running around doing a lot of things. Is that not enough? Do I have to stop and stretch when I haven't been sitting around. I've been walking around. Talk about that, will you?
So stretching's an interesting subject because there's a lot of research on stretching that's out there, and some of it conflicts with one another. My thing is, if you're going to have a stretching routine that you follow, you continue doing it. If you're not going to stretch and you choose not to, and you're only going to do it once in a while, you're better off not doing it. When you do something once in a while, like, I think I'll stretch today before I run, and you don't normally do it, you actually run a higher risk of injuring yourself when you do it beforehand. So if you're going to stretch once in a while, or if you're going to stretch for recovery, do it after your exercise for the day instead of before.
Okay, so is there a need for me to do something before I get on that bike? I mean, I'm not a crazy bike person. I'm not doing spinning. I'm just
warming up does help. The reason you'd want to warm up is your joints, when they're not moving quite as much, the fluid inside them tends to get a little thicker. So if you think of it like butter in the refrigerator, when it comes out, it's hard, but if you leave it on the counter, it gets soft, and if you put it out in the sun, it melts. Well, the fluid inside your joints, when you move it around and warm it up, it becomes more liquidy, like butter would in the sun. So you want to make sure that your joints are warm and they move freely and easily before you jump into any exercise. A lot of people don't do that.
Right.
They just go out and start.
I'm listening.
Yeah,
I'm listening.
They just go out and start doing what it is they want to do, and when they're done with that exercise, they're finished, and they go back to sitting in their car, sitting at their desk, and that's the issue. They're missing the recovery process.
So can you verbally tell us what a good stretch is? By the way, let me tell everybody again who I'm talking to. This is Dr. Jason Alviene, and if you want a chiropractor, you're going to want to go to him. He is located in Delray Beach. It's called PROFUSION CHIROPRACTIC, and his phone number is 561-504-6344, and I want to just find out. So tell us all, we're listening. Tell us verbally what a good stretch would be.
Well, stretching, I would recommend doing it after your exercise. It seems to work out better that way, because with the stretching of the muscles and the pulling, as you're doing that, you're changing the muscle tissue, and if there's anything stuck, it might start to free up. Well, that area that was stuck, that free up, almost like picking a scab, it could make the muscle a little more predisposed to getting injured. So doing it afterwards, you're not going to get injured. You can then go about your day. If you're doing it before the exercise and you don't do it regularly before an exercise, or it's not a routine, you find that most people could get injured that way. So stretching, there's so many different ones out there. There's upper body and lower body. It depends on where a person is.
Let's just say I'm going to, you know me enough, and I'm going to get on this bike. And, and I can't even describe what I do on the bike. I do it's called 6 or 7. I'm not at one. I do it, and I do it for I try to do it for at least 10 minutes, but sometimes 20. And I just sit there and, watch CNN or something.
Okay.
So tell me, what should I do?
Well, so to warm up before you get on the bike,
Okay.
It wouldn't actually be a stretch. You're just warming up first.
Okay.
I would bring your knee into your chest, kind of pull it up.
Oh, I do that on
warm
my
up,
bed, both
and
of
then,
them.
And then bring to the side and get the
Oh.
hips to open up from side to side. You're going to want to reach your arms up over your head and lean back and open up the hips that way as you're standing up. So you want to get the hips warmed up and the knees warmed up, because you're going to get on a bike that's going to cause a lot of motion. And then when you first get on the bike, you probably want to do about anywhere from like a 2 to 3 minute warm up, where you just go slow and let the joints get used to the movement before you speed up. Then afterwards, stretching, hamstring stretching, quads stretching, so the fronts and the back of the legs, adductors and abductors, so the inside and the outside of the legs. So lots of stretching this way and that way and side to side. So you're going to want to do all that to help open up those hips. That tends to be what most people have an issue with because of this sitting position we're in most of the time, is the hips really get tightened up.
What about taking a hot bath? What would that do?
Hot bath will warm up your tissues, but it doesn't get you warm to where you move through a range of motion where the joint needs to move through. So you can warm up something, but if it's sitting in one place and not getting that movement, it's not going to be as good.
So I mean, like after, it doesn't. It's still. You still want to do those stretches.
Yes, yeah, but you want to do it on a regular basis.
Okay.
Yes, it's.
But you know something else I do now. I'm on the 7th floor and I walk down the stairs. I know up I can only do about 3.
Okay.
I'm working on it, but I do walk down 7 and it's about 125 steps. And I think and I don't stretch to do that. I just walk down, but.
Yeah, it's like with most
that's
of our...
like a stretch in a sense, isn't
it?
it?
Yeah, with most of the exercise, I would always recommend stretching after the exercise. So if you're going to walk upstairs, you don't really need to stretch beforehand.
But what about walking down? I mean, that's my stretch in a sense, isn't it?
Well, walking down, it's not really stretching. It's not really stretching. Walking down is definitely easier than walking up, unless there's certain conditions out there that would make it hard to walk downstairs, certain knee issues. But for the most part, if your body's working well, walking downstairs is always easier than walking up.
But it's harder than taking the elevator.
Yes, it is. Yes, it is. Oh, don't get me wrong. Walking downstairs is fine.
Yeah, give me some credit for that.
Definitely better than the elevator, but it's not a stretch per se.
I understand that. So that's you have a lot of very good advice. Okay, well, let's go back to chiropractic. So one thing you told me when I first met you, that you work with a lot of athletes. Now, they don't have to be NFL players. They can be people who play tennis. They play, all other kinds of. Now they have this other kind of tennis. What's it called? It's called pickleball.
Yeah, pickleball. It's been out since the 1960s.
Really?
Yes.
But I've just heard about it recently.
I know. I had a patient that I had worked with recently that was really into pickleball to the point where he was learning how to become a coach for it. He got into the game and absolutely loves it. So
why does he love it? I've never played pickleball or even seen it.
I've never played. He loves that it's on the smaller court, and he goes the ball kind of like flops around, so he said it's almost like a cross between like badminton and tennis. And so because I had learned about what he was doing, I went and researched it and read about how long ago it started. From what I remember, it was the 60s. It could have been the 50s, but I remember somewhere in that time, 50s or 60s, this game came about, and now it's becoming popular.
I think it's because a lot of people who used to play tennis can't anymore. And then this is what they feel more comfortable, because don't you have to have partners? You don't play alone, do you? Or?
You can play I think singles and doubles, but
really?
it's a lot smaller court, so you're still it's still a fast-paced game, but you're not having to run back and forth like you would in tennis.
Oh, I see. Okay, so let's get back to that question. So now you're dealing with people who are active in sports. So is it a different kind of a chiropractic with your sports people? Let's say not just a retired person, but someone who's very active and playing sports, and it could be kids playing football or whatever. What are the dangers in all these sports, all the games? Because there are dangers.
Well, you find that it comes down to the frame of mind, the people that want to play sports versus the people that don't. The people that want to play sports, they want to be able to perform better, they want to be able to use their body better, they want to make sure that they don't get injured. So it comes down to, when I'm working with somebody in that realm, how can I help them to make their body better so they can function better in their sport, versus somebody that's typically not sports active. They're looking to function better at something else, whether it be, I need to be able to sit at my desk longer for the day. So the person themselves, I have to figure out what it is that they're trying to accomplish, and then work with their treatment that way to make sure that they can hit that goal.
I'll bet that's a big problem with people who want to sit at their desk excuse me. I have a stand-up desk. I've had one for 7 years.
Mm-hmm.
I don't always stand up because, you know, after you get tired, but it's really, there are new ways now. You can just buy them, you put them on your desk. Do you have a stand-up desk?
Technically, yes. I really don't have a desk.
Oh,
so,
right. That's a good answer.
Yeah, I mean, my when I do my notes with my patients, I'm putting my laptop on a counter or something along those lines and going through it. But for the most part, I'm up and moving around. So when it comes to sitting or standing or any of those things, it's not about the actual sitting or the actual standing. It's about the repetitive of it. So if you're sitting in a seat for say 8 hours, your body's in the same position for 8 hours. If you're standing behind a desk for 8 hours, your body's in the same position for 8 hours. Our bodies are meant to move and change. So being in the same position for a long period of time, that's when you start noticing problems, because the same stresses are put on the body over and over and over again. So getting in a car, I recommend to all my patients to once every week to once every 2 weeks, change the position of their seat in their car. So they're not in the same spot all the time. Even if it's just a quarter of an inch, a very slight move forward, move back, move it up a little bit, move it down a little bit. Just get your body in a slightly different position so you don't use it the same way all the time. That's when you run a higher risk of getting an injury or having something bother you.
That's very good advice. I drive my car a lot, so sure, I could do that.
Yeah, you just move this. It's like next week, just move the seat up a little bit and then move it back to the same spot that you did the week before. It's about having that change in there versus doing the same thing over and over and over again.
So it's the memory. The memory is like having, right, it's like memory foam.
Yes.
It's used to what you're doing. Oh, that's very good. Well, I'll keep that. That I can do easily.
Yes.
Change it, right? Change my position. Okay. But something else you were saying, the times that I get very engrossed in what I'm doing, Dr. Alviene, and I will sit at my desk or wherever I am, if I'm home at the table working, and sometimes an hour can go by, and I know I should get up every 20 minutes or something, right?
Oh, yeah. So when you, like you said, you get engrossed in what you're doing, this is where our cell phones actually come in handy. Set an alarm. With our phones, you got people that can talk to Google and talk to Siri, whatever you end up having, and say, set an alarm for 20 minutes from now, and then it'll go off. It'll remind you, I got to get up and move. 30 minutes, whatever you're doing, but give yourself that break. I'd say every 30 minutes. I like doing 20, but no more than 30 minutes. Give yourself that break and let your body change positions.
So this will help you, sorry to say this, having to go to the chiropractor.
Yes.
I don't want to give up on your business, but I think that people could do more for themselves. But we never talk about proper eating, diet, and all that. And I know that you're very thin, and I think that you really know about that. So when you work on someone and then you send them home, and if you haven't told them, what they should be eating, I think you're missing out. But so you probably do, don't you? Do you go into their food regimen a little bit?
I will discuss it with the patient, and it depends on where they are at the time.
They want to hear it, right?
Yeah, some patients I'm fine with the way I'm eating, and I don't want to change it. So then I work with them with what they want to do. This is what I have to offer. What would you like to do? So obviously the main focus is the chiropractic portion, but nutrition, home exercises, supplements, these things are a part of recommendations that I give. Whether the person's going to do them or not is up to them, but I give the recommendations.
Okay, so on the time we have left, what is a nutrition plan for somebody who just wants to eat better or to, sleep better or something from food?
Well, if somebody wants to eat better, the main thing you have to do is you have to cut down on the processed foods. So that's seems like a no-brainer, but it's one of those things that you have to bring up. Stay away from the processed foods.
Give us an example of a processed food.
If it's in a box.
In a box or a can.
If it has an ingredients list, it's been processed. You don't find an ingredients list on an apple. So
that's very interesting.
The more ingredients something has in it, the more process it has gone through.
Well, that's another good tip. Okay, so everything that comes off the tree or out of the dirt or something.
Yeah, it's definitely better for you. It just is. But realistically, we know people are going to enjoy eating their Oreos or whatever else is out there. But the main focus is to what is it that you're looking to do, and how much do you really want to jump onto a better lifestyle diet. But we talk about that. I have a lecture that I do on what's known food cycling.
Oh, you do?
Goes through the 3 aspects that I look at for changing the way that you would go about looking at food and the way you would eat. So the food cycling has the 3 parts where you're looking at the quality of the food that you're eating, the quantity of the food that you're eating, and the timing of the food that you're eating. So it seems difficult, but when you go through the lecture, I mean, it's about an hour lecture. I do these frequently throughout the town, so I mean, these can be set up anywhere. I just like going out and do them, but it helps somebody learn how to eat better. And they can use, I mean, you can pretty much put any diet into it. If somebody's vegetarian, they could use this process to eat. If somebody wants to eat a lot of meat, they could still use this type of diet to be able to eat. So it's not you can only eat this food. It's what are you currently doing and how do we make it better?
Well, you've just given me an idea for our next radio show.
All right.
Come prepared.
Come prepared. I can do that.
I think that will be fabulous. I just love this idea. So we're going to have a whole, what do you call it? What's the title of that speech?
Food cycling.
Food cycling as compared to bicycling.
Yes, yes.
Food cycling. So there is a cycle to eating food.
Yes. Oh, yeah. Like,
I'm very interested in this. This is
every day the world goes around 24 hours. It's a cycle.
The moon comes up and the sun goes. This is very interesting. I don't know why we never talked about this before. I can't wait.
Well, we got a lot of stuff going on. So.
Yeah, well, that's really good though. And so you do this for your patients, I gather. You go through this, or I know you said you do this as a speech.
So yes. So within the practice, I'll hold weekly lectures that anybody can come to. I invite my patients, but I'll let anybody come to that wants to come and just learn about what we do. So, well,
in our magazine, we should be in our events column, which are only for free, free lectures. We ought to be putting that down that people can come, and of course, you'd have to have a particular time. I don't know if you do that at a particular time of the day or.
Yeah, I'm doing Thursday evenings.
Okay, Thursday evenings. Well, we're working on our December issue. And we'll talk about that, and we'll list that in there and see if some people listening want to come and do that.
Okay. That's
because I think there's a lot of confusion out there now about what to eat. I usually have a fantastic drink in the morning. I use, all the good stuff that you could imagine that goes in there, the banana and the spinach, and I use hemp seed, and I use a lot of, flax seeds and all good things, lots of frozen fruit, and that's good for me. I do that, and I use almond milk. I learned all this. Yeah, yes. I learned all this from my pulmonologist, and he does that. And so the morning, that's pretty good. I start that off, and then lunchtime, then I have to think about what I should do. I eat a lot of pistachio nuts, too, which are very good. When I'm in the car, I open them up as I'm driving. Oh, very bad. I'll tell you about that later. Anyway.
You don't do the red ones, do you?
No, this is all natural. No, all natural. Anyway, we've run out of time. We'll see you again next week. I thank you very much. And you've been listening to Dr. Jason Alviene, and you can catch him on Facebook Live. And thank you very much for being here.
All right, thank you.